When I started with Trilogy, I really liked this kind of work, but it's very intense as far as giving quality services and being able to meet documentation deadlines and direct service goals. And I often, on a daily basis, would find myself at the end of the day, after hours, doing notes and stretching out and waking up the next morning and finishing more notes and statusing notes. It was all about notes, notes, notes.
Trilogy primarily provides community-based services, so including ACT and CST services. And that means that our staff are driving around a lot. I think the challenge really has been that field-based workers didn't have an opportunity to do the data entry, of note writing in the field. Most notes were taking our staff about 15 to 20 minutes each to write. So when you consider that 15 to 20 minutes for 6 to 8 interactions per day, our staff were spending anywhere from like potentially 2-ish hours a day on note writing, and that was just entirely too much.
It was somewhat stressful trying to practice self-care, which my supervisors were constantly encouraging me to do. It was difficult.
I think there's also an emotional burden of note writing that was unnecessary, and we were hoping to resolve some of those issues as well. Staff would get behind, feel overwhelmed, and then just leave the organization. So what we really need to do is identify what are the problems that our outreach staff are facing, and really develop a product that was going to be able to meet those workflows. So we just kind of had an idea of what could that look like, and we worked with Eleos back and forth on that vision, and we have developed this product.
If you're not embedded within the user's workflow, it doesn't matter how good the notes quality would be. So you actually need to be integrated within the workflow. Being integrated within the EHR, both for reading data and for writing data, is crucial.
I wish that all new technology implementation was this easy. We demoed the product for them and had a party the rest of the time. So, I mean, essentially 1 hour took care of the entire training process for the staff who launched with us. And that included the time it took for them to take a picture of the QR code and log in for the first time. So even in the demo, they all had notes from the previous day. So they had a chance to do a note right there during the training and watch it get moved into CareLogic, where they could then sign it right there before the training was over. So super simple, intuitive experience. A lot of what happens in a session is pretty routine, and it captures that routine part and just frees the staff up to really focus on the part that made it a unique experience for the client. We've already experienced that it's taking our staff a lot less time to submit notes. So that means from time of service to submitting the notes, but it's also taking less time to actually document the note and do the drafting of the note. 90% of the staff report that Eleos has helped reduce the amount of stress in their daily work. 72% say that they enjoy their clinical note writing with Eleos. 95% of staff report Eleos has made the note writing process much easier. 70% of staff report significantly shorter lag times, which is service to sign, which is also backed up from the data that we collect more quantifiably.
Whereas notes used to take 8 to 10 minutes to complete one note, my notes are taking probably a total of 2-3 minutes tops to complete. There is absolutely no after hours note writing anymore. I'm able to focus on self-care, and it looks like I'm able to go back to school full time as well. So this has really changed my life tremendously, and I can't say enough about it. It's easy to use. It's just a matter of a couple of clicks and go back, take a look at it, make sure that the note is tight, and it's done. I love it.